When it comes to family planning, it is important for you to talk with your gynecologist, talk with your doctor, and understand the one effectiveness of that family planning. Two, the side effects of that family planning. Three, the delay time of the family planning before you conceive once you stop using that family planning. Because unfortunately, most of us get into family planning without understanding any of this, and when we start facing some difficulties, we start rushing back to our doctors. It's important that you talk with your doctor and understand all of this. There are several family planning methods, and some will cause a longer delay if you want to get pregnant right after stopping it. Today, I want us to talk about DEPO, which is a hormonal family planning method given through your muscles. Preferably, you should give, most ladies will take it through the arm, but you can give it through anywhere where there are muscles. Now, this family planning method prevents you from getting pregnant within 3 months, and you can renew it after 3 months. It is generally flexible, and most of our sisters, especially students, love this. You know what? Because by the way, when you take this, you're fine, no one knows what's going on, and so on, so you can pull up with life. But it's important that you understand some of the side effects of this specific family planning and what is the delay time of this family planning. Generally, for this particular family planning, which is the DEPO given through muscles, preferable through the arm, it can cause abnormal vaginal bleeding once you take it. It can also cause you to bleed longer than usual. It can also delay menstruation even after stopping it. And for that fact, it will also delay ovulation even after stopping it. Some ladies might only resume ovulation after 6, 7, 8, 9, and even 10 to 12 months once they stop using DEPO. So you see that the delay time for DEPO is somewhere around 4 to 12 months. That's maximum about a year. If you're a young lady, you're enjoying life right now, and you decide to take this DEPO, then suddenly one Mr. Right pop in. Rapidly you are in love with this guy, and you are thinking about marriage, let's say within 3 months. Remember that you have this on you, and this guy says, I want a baby as early as possible. Both of you agreed, but you still have this thing. Yes, it has expired, but now look at the delay period. It could carry right up to a year. Just imagine you meeting this ideal guy, this Mr. Right, this person that you've been yearning to have, only for you to suffer the effect of not achieving your goal, getting pregnant right after stopping this family planning, because it's going to delay you probably up to a year in some situation. We're not saying every woman will have this delay up to a year, but generally it could delay you and you only conceive up to a year. Look at the danger that is gonna cause you. So my advice to every woman, please only go on family planning if you understand the side effects of this family planning. If you also understand the delay period of conceiving of this family planning before you move on with it. If not, you might find yourself in a very difficult situation after using this family planning, and you start thinking, oh, the world is against you and so on. You start having many thoughts in your head, which is not so. Now, if you've known the side effects, you know the delay period, you look at your life and you say, okay, why will I go on this? If maybe if I meet somebody whom I'm interested, I can get married. But if maybe within your mind, you know, there's nothing about pregnancy, maybe in the next 5 years, you are sure. Then if you go on this family planning, obviously you know that whatever thing happen is it will take about 5 years. Another thing I want us to understand is avoid taking this particular family planning continuously without taking some breaks. Personally, I will advise you to only go on depot once in a year. If at all you want to go on it for like 2 3 years, like some ladies do, then you take it January, for example, January 10 to February 10, that'll be 1 month, February 10 to April to March 10, that'll be 2 months, March 10 to April 10, that'll be 3 months. So it's over. Hold on till next year and you go on another depot. Don't just start it and April 10 expired, maybe by April 12, 13, 14, 15, you go on another depot. If you go now another depot in April 15, let's say April 15, therefore means May, June, July. So July 15 expired, maybe by 16, 17, 18, you're going on another, which therefore means it will be August, September, October. So by October 18, it expired. So avoid going on it continuously. Take a break and only repeat it next year so that you give your system some time to come back to normal so that you will not have the difficulties which comes along this particular family planning method. If you are a student and you want to go on family planning, you don't have a child yet, personally I will not advise you to do that. Well, if you choose to do that, please understand that you might have some difficulties conceiving right after this. I'm talking in particular this depot injection taken to prevent pregnancy every 3 months. And if you go on it, remember that this does not prevent you from having STI such as human papilloma virus, the HPV that can cause you to have cervical cancer. It does not prevent you from having STI such as HIV. It does not prevent you from having STI such as chlamydia, which can make it harder for you to get pregnant. So, once you go on it, also remember to do your checkup with your partner, because that's another thing. When you go on it, you're switch off and you might just start having intercourse here and there because you think that you're safe, but there is a greater danger if you are not careful. You might get infected, and this makes it harder for you in future. Thank you so much for following. I really do appreciate those who are interested in a one-on-one discussion. Please use the number on the screen. Send a WhatsApp message that you want to pay for a one-on-one discussion. Please do not send a message if you're not ready to pay. Please follow my live stream right now. Don't forget to share this video. Also follow us on all our platforms, that's including YouTube, Facebook, TikTok, everywhere. Thank you. May God bless you. Do have a wonderful day.